Good morning, everyone. I'm Dr. Bhagyalakshmi, Assistant Professor, Department of Biochemistry, Palad Institute of Medical Sciences. Today, I'm going to speak on vitamin C. This is one of the water-soluble vitamins. The structure of this is also known as ascorbic acid. It has got resemblance with glucose and with removal of two hydrogens and addition of two water molecules. And this synthesis is going on. This is the structure. The biomedical importance and deficiency of this vitamin C results in skin changes and fatigue and ecchymosis we can see in skin, and epistaxis, this is bleeding through nose, and the perifollicular hemorrhages and gum decay and tooth loss. Bone fractures we can see, joints will be swollen, anemia is and wounds will be delayed. Healing of wound will be delayed. This vitamin C is easily destroyed by heat, change of pH, and light, and it is very much soluble in water. Oxidation of vitamin C is rapid in copper vessels. Hence, it is inactivated if food is cooked in these vessels. The whole body pool of vitamin C is 1.5 grams. And body pool is sufficient for 3 to 4 months, and the half-life average is 16 days. Absorption, coming to this, when about less than 100 milligrams is taken, all of it is absorbed. When more than 1 gram is taken, only 50% is absorbed. Absorption is through simple diffusion, active transport, facilitated diffusion, and specific transporters. And excretion is unchanged, diketoglutamic acid, oxalic acid. And primates and men cannot synthesize vitamin C due to the lack of this enzyme glutathione oxidase. And here, glucuronic acid synthesis, glucose 6-phosphate, and conversion to glucose 6-phosphate to UDP glucose, and again reversible reaction UDP glucuronate or glucuronic acid, and the glucuronides, proteoglycans, and glycosaminoglycans can be synthesized from these, and finally ascorbic acid. See, this is ascorbic acid from this. The sources of vitamin C are now, it's just a source, and good sources are citrus fruits, tomatoes, guava, cabbage, and cauliflower, and fair sources are green leafy vegetables, potatoes, apple, banana, milk, liver, and meat. Main functions of vitamin C are collagen synthesis is one of the important things, and it has got antioxidant property, and promotion of non-heme iron absorption, and synthesis of carnitine, and immunological functions, bone formation, synthesis of corticosteroid hormone. This is one of the component of drug metabolism enzyme system. It is mixed function oxidase. Functions in connective tissues is also another important function. And the biochemical role is acting like coenzyme. This is, and its capability to undergo reversible oxidation reduction reactions. See, this is the reversible reaction, ascorbic acid to dihydroascorbic acid. See the removal of this, and with the addition of two hydrogens, this is taking place. Metabolic cofactors in reduced form. Collagen formation also. Yeah, ascorbate is very important, and vitamin C plays good role in as coenzyme in hydroxylation of proline and lysine, which are very much important for the synthesis of collagen. And the hydroxylation reaction is catalyzed by lysyl hydroxylase for lysine and propyl hydroxylase for proline. The hydroxyproline and hydroxylysine are essential for the collagen cross linking and the strength of the fiber. So this is the structure of collagen, 3 helices, and this is triple helical quarter standard structure. These 3 helices, this is quarter standard structure. Part of this is staggered by the next layer. Part of this is staggered by the next layer, like this. This is quarter standard structure, and many triple helices assemble into a collagen fibril. And it is vitamin C is very much important in tyrosine metabolism. This it gives rise to norepinephrine and epinephrine with the catecholamines. So this is degradation of tyrosine. See here. Tryptophan metabolism also vitamin C has got good role. Synthesis of serotonin. And bile acid synthesis also, vitamin C is very much essential. That is produced from cholesterol, the deoxycholic acid and taurofolate, glycofolate. It is from bile acid. Vitamin C is very much essential for the synthesis of this. And carnitine synthesis also. And this is trimethyl gamma ammonium butyrate, very much important in fat metabolism. Here, this is the step taking place in cytosol from this transport of carnitine. See here, it has got its role, entry through the membrane and to the matrix. That is the reason for this also vitamin C is very important. And one more important function of vitamin C is antioxidant and free radical antioxidant property. One of the important function is this is also known as antioxidant vitamins. Vitamin C, ascorbic acid. See, your antioxidants have extra electrons that they can donate free radicals. Say free radical missing an electron in its outer shell here. This. See liberation of free radicals. No. That will be shown with superscripts. This thing also. See how this free radical and cell from this the how the damage to the cell death takes place, and this is the with the superscripts, the free radicals and antioxidants role here. If it is deficient over here, this process and damage to all proteins, DNA, lipids, carbohydrates, they take place and the cell death will be possible. That is the reason why antioxidants prevent this reaction. C is SOD enzyme catalase. Vitamin E also comes under antioxidant vitamins, glutathione and vitamin C, which we are studying now. This has got good role over here. Deficiency leads to this. In lympholate metabolism also, vitamin C is very much essential. Active form of vitamin folic acid is tetrahydrofolate, and vitamin C is needed for the formation of THFA, that is tetrahydrofolic acid. Next is coming to immunological function of vitamin C. It enhances the synthesis of immunoglobulins and increases the phagocytic action of leukocytes. Next function is bone formation. Bone tissues possess an organic matrix, collagen, and the inorganic calcium and phosphates. Iron absorption also needs vitamin C. Vitamin C enhances the absorption of iron by keeping it in the ferrous form. This is due to the reducing property of ascorbic acid. Next is hemoglobin. Helps on reconversion of methemoglobin to hemoglobin. And the synthesis of corticosteroid hormones also. See, monooxygenase system of mitochondria. Adrenal gland possesses high levels of ascorbic acid, particularly in periods of stress. And so vitamin C is necessary for the hydroxylation reactions. And drug metabolizing in the liver, monooxygenase system of liver microsomes. This is the whole summary functions of vitamin C. Here, collagen synthesis, carnitine synthesis, this norepinephrine, epinephrine synthesis, peptide hormones, and tyrosine metabolism. And see here, conversion to ascorbic acid to dihydroascorbic acid, and increased iron absorption in gastrointestinal tract. This is the chemical reductant. And antioxidant property also. Reduction of harmful free radicals will be done with the help of this vitamin C. See, it is reducing oxidative DNA protein damage, low density lipoprotein oxidation, lipid peroxidation, oxidants and nitrosamines in gastric juice, extracellular oxidants from neutrophils, and increasing endothelium dependent vasodilation. And the preventive action on chronic diseases. And free radicals are constantly produced in the normal metabolism, and they cause serious damage to proteins, lipids, DNA, and the cell membranes. These free radicals are implicated in the development of cancer, heart diseases. And this prevents cataract formation. Cataract is opacity, increasing opacity of the lens of eye. And preventive action, it is good in atherosclerosis and gastrointestinal cancers, arthritis, Alzheimer's disease, and vitamin C prevents from all these disorders. And deficiencies are usually seen in infants and children, and alcoholics, smokers, elderly people, and dialysis patients. And when patients are on certain drugs like oral contraceptives, steroids, aspirin, and barbituric drugs, and the deficiencies are seen usually. That is the reason vitamin C to be supplemented in all this. Usual clinical features what we see observe is fatigue, lack of appetite, joint pains, cognitive impairment, irritability, body pains. And scurvy is one of the important deficiency disorders of vitamin C. See, bleeding through the gums, petechiae ecchymosis in the skin, and inflamed gums, bleeding into joints, peritoneal cavity, pericardium. With this bleeding, anemia we can see, and wound healing will be delayed in all these when this is deficient. Scurvy in children is called as Barlow's disease. And hemorrhagic tendency due to fragility of capillaries, and when blood loss anemia is seen, that is due to bleeding, decrease in absorption of iron, and defective conversion of folate. Delayed wound healing is another one, and scorbutic rosary is one of the things you can see in vitamin C deficiency. That is, a groove is present in between osteal cartilage and the rib. That is scorbutic rosary deficiency we can observe. Bone changes are rarefaction of shaft of the bone, and epiphysis resembling ground glass appearance. Thinning of cortex is present, and it is brittle and fractures may develop. And the subperiosteal hemorrhages are seen due to leaking of blood from vessels, resulting in stripping of periosteum. Dentin is defective due to the defective formation of collagen, resulting spongy gums. With that, bleeding through the gums. we can see that is coming. See, these are the petechial hemorrhages. It's a periosteal hematomas, and scurvy, oral bleeding through the gums, spongy gums, swollen gums, inflammation, fully developed scurvy. The gingiva becomes boggy, ulcerated, and bleeds, and color changes and violaceous heredity. See, we see the X-ray of bones, pensile cortexes, ground glass appearance, and periosteal elevation. Also, we can observe. See, vitamin C deficiency, impaired collagen formation, leads to poor vessel support, and results in bleeding tendency. It is in gums, in skin, and periosteum and bones. And here other effects also, impaired wound healing. This is the structure of skin layers, delayed wound healing, and here inadequate synthesis of osteoids. These are the consequences of vitamin C deficiency. Scorbutic rosary disease, ribs, all petechiae, the skin, and then gingiva, swollen gums, inflammation, loosened teeth. Then the investigations what we do is increase of vitamin C level in the blood. That is normally is 0.4 to 0.6 milligrams per deciliter, but less than 0.2 milligrams per deciliter in deficiencies. Vitamin C loading test will be there. That is 10 milligrams per kg of vitamin C is given, and more than 80% of it is excreted in urine. If excretion is less than 20%, it indicates the deficiency of vitamin C. And vitamin C levels are decreased in WBC and platelet of FeCOAT. And recommended allowances in males is 90 milligrams per day, in females 75 milligrams per day. And during pregnancy and lactation, additional 20 milligrams, and lactation 40 milligrams per day can be given. And with vitamins, there are toxicities also. More than 2 grams as a single dose may result diarrhea, abdominal pain, and nausea. Renal stones are possible with toxicity, iron overload, that precipitates hemochromatosis, and doses more than 1 gram per day can cause false negative uh, reactions and also interfere with tests for urinary glucose, because Benedicts will be positive with ascorbic acid. And with this, vitamin C topic is over, and